New today, a stern warning from the World Health Organization this morning that even if you have COVID-19 antibodies, you may not be immune from contracting the virus again.
Right now, we have no evidence that the use of a serologic test can show that an individual is immune or is protected from reinfection. What the use of these tests will do will measure the level of antibodies, and it's a response that the body has a week or two later after they've been infected with this virus. And these antibody tests will be able to measure that level of seroprevalence, that level of antibodies. But that does not mean that somebody with antibodies means that they're immune.
All right, joining us now, Dr. Sujata Amadar. Good morning to you, an infectious disease specialist. Doctor, there has been such an emphasis on getting these antibody tests out to everybody so that we can reopen the economy. Does this mean that, okay, if there are varying levels of antibodies, if you have more antibodies, you're less likely to contract it again? What does this new information mean?
So I think, as was mentioned by the WHO and other guidelines, we don't really know what antibody testing means. I think we have to be careful in terms of how the serology is used, and we have to be careful about how it's used in terms of monitoring the disease.
And doctor, how does that information compare to other viruses, the likes of, say, the regular flu or SARS? How immune are people who have those antibodies?
So with viruses, it's more challenging. For example, I give the example to some of my medical students or residents is that certain bacterial infections, for example, hepatitis A, if you do have antibodies, you have lifelong immunity. With viruses, it's much more difficult to determine what the antibody means. And just having an antibody does not reflect an immune response.
Since antibodies don't guarantee immunity, we do know that they showed someone has been exposed to the virus. And Stanford University did a study of antibodies in California's Bay Area. They found that between 48 and 81,000 people could have been infected, far higher than official numbers. So, Dr. Amadar, does that mean that there could be an even larger part of the population who has COVID-19 and just didn't know?
Well, certainly there's a lot of information that we've had asymptomatic transmission, that people who didn't know they had the infection with the typical symptoms such as fever, cough, or shortness of breath may have had the infection and may have been able to spread the infection. So I think it's plausible that there was a larger number of people that may have had the infection and spread it than we may have thought based on things we saw in the clinics or hospitals.
Okay, so we have that, where there are so many people who are asymptomatic and they're spreading the virus. But there's also this that is really troubling to me, the fact that in those numbers that we're getting out of South Korea, at least 160 people who tested positive once, then tested negative, have the virus again. What are we to make of what's happening over there?
So again, I think it shows us that we have probably limited information in terms of the transmission and virology in this case. And we also don't know whether people that have virus that's present on testing, it's actually a viable virus. We are seeing patients who, when they get tested by the nasopharyngeal swab testing, may have a positive test even more than 2 weeks after, up to 3 weeks after, but we don't know what that means clinically.
Still a lot to learn. Dr.
Yeah.
Sujata Amadar,
Absolutely.
thank you so much.
Thanks.